Hello. You've been referred to your regional genetics service because a member of your family has been found to carry an inherited gene alteration in a cancer risk gene. This video is aimed to provide you with the information you need to know about the genetic test you are being offered. After watching this video, you will have an appointment with a genetic counsellor to discuss this further. 1 in 2 people will develop cancer in their lifetime. Most cancers occur by chance. Only a small number of all cancers are caused by an alteration in an inherited unit called a gene. Genes are instructions that tell our bodies how to grow, develop, and function. We have 2 copies of every gene. We inherit one from our mother and one from our father. Sometimes people are born with alterations in their genes which can cause genetic conditions or genetic predispositions. These changes are sometimes called pathogenic variants or mutations. We will refer to them as gene alterations from now on.
You may have heard that there is a diagnosis of Lynch syndrome in the family. Lynch syndrome is a cancer predisposition condition that results in an increased risk of certain types of cancers. There are 5 genes associated with Lynch syndrome, and the risk of cancer differs with each gene. This video is about PMS2. Usually, people have 2 working copies of the PMS2 gene that help protect them against developing certain types of cancer. When a person has a PMS2 gene alteration, this means they have 1 copy of the PMS2 gene which is working correctly and 1 copy of the PMS2 gene that isn't working correctly. People with 1 copy of the gene which isn't working have an increased risk of developing certain cancers.
As your relative has been found to carry this gene alteration, there is a chance you may have inherited the same gene alteration. The chance that you have inherited it depends on how closely you are related to this relative. If you are a first-degree relative, for example a parent, sibling or child, there is a 50% chance or a 1 in 2 chance that you carry this gene alteration.
If you have a PMS2 gene alteration, it does not mean you will definitely get cancer. It means that you have an increased risk of developing PMS2 associated cancers and have a diagnosis of PMS2 related Lynch syndrome. Based on current evidence, people assigned female at birth with a gene alteration in PMS2 have an increased risk of bowel and womb cancer, as shown in the table. Based on current evidence, people assigned male at birth with a gene alteration in PMS2 have an increased risk of bowel cancer, as shown in the table. If you are found to have a PMS2 gene alteration, you will be able to discuss management options in detail with your genetic counsellor. People with a PMS2 gene alteration are offered 2 yearly colonoscopies from the age of 35 to 75. After age 75, this can be reviewed with the GP if they still wish to continue screening. There is currently no proven effective screening for womb cancer. To help reduce the risk of developing womb cancer, a risk-reducing hysterectomy, which is a surgery to remove the womb, can usually be done after the age of natural menopause. This surgery significantly reduces the risk of cancer by more than 95%. You can discuss this further with your genetics clinician. Aspirin has been shown to reduce the risk of cancer in people with Lynch syndrome. Aspirin is usually offered from age 18 to 60 to people who do not have any medical reasons for not taking aspirin. We also recommend a test for Helicobacter pylori, which is a common bacterial infection of the stomach, before aspirin is started. This can be tested by the GP and treated with antibiotics. You will discuss this further with your genetics clinician and GP if relevant.
You will be given a personalised risk assessment based on your personal medical history. We will address the risk relevant to you in clinic. Changes in your lifestyle can sometimes reduce your individual cancer risk. These include maintaining a healthy body weight and a healthy diet, not smoking, only drinking alcohol in moderation, and exercising regularly.
There are 2 possible outcomes from your genetic test. The test could show that you have not inherited the gene alteration. You would therefore not be at an increased risk of developing the cancers associated with this gene alteration. If you don't have the gene alteration, any children you have do not need to be tested. You should still participate in NHS population screening programmes. If you have any unrelated family history of cancer, this will be assessed and discussed separately. Your test could show that you have inherited the gene alteration. This would mean you are at an increased risk of developing the cancers associated with this gene alteration. You would be invited for another appointment with the genetics team, where we would then discuss the appropriate options for you to help manage your risks of developing these cancers. If you have children, they would have a 50% risk of having inherited the gene alteration. Typically, there is no significantly increased cancer risk for children. Therefore, they are offered genetic testing when they are at the age of 18, when they can consent for themselves. If you haven't had children but are planning a family, there are options available to avoid passing on the gene alteration to any future children. We can offer pre-implantation genetic testing using IVF to select unaffected embryos, or we can offer genetic testing in pregnancy. Many people opt to have children naturally, knowing that their children could be tested and offered risk management options in adulthood. We could discuss these options in more detail if you want to explore them.
It is important to think about the advantages and disadvantages of genetic testing before deciding to have a test. It is also important to think about the emotional aspects of genetic testing. Learning that you have a gene alteration means that you and your relatives can take steps to manage your risk of developing cancer in the future. You can make certain lifestyle changes to lower your risk, have regular screening, and have preventative treatment. You would have the opportunity to avoid passing the gene alteration on to future generations if this feels important to you. Knowing the result may reduce any stress and anxiety that comes from not knowing if you have it or not, and help you to feel more in control of your risk. Learning that you have a gene alteration may cause increased anxiety for some people, while others may not feel anxious at all about their result. It's important to make a plan that you feel comfortable with to help you cope with this anxiety. This may be talking to your friends or family, doing things that usually help you cope during difficult times, such as exercising or finding good distractions in your hobbies or interests. If you feel your anxiety isn't well controlled, you can speak to your GP to see if talking therapies or medication might be appropriate for you. This test can be undertaken at any point, and the timing is up to you. Sometimes it may be appropriate to delay the test until you feel you're in the best position to cope with your result. It's also important to know about the financial implications of genetic testing. There is currently an agreement preventing life insurance companies from asking for this type of test result. This may be reviewed in the future, so it isn't guaranteed to be the case forever. If you would like more information about this, you can contact the Association of British Insurers. The information we have given you in this video is correct at the moment, but we are still learning about cancer genetics. There is always the possibility that new evidence may emerge in the future which could alter our advice. You can get back in touch with us at any point in the future if you have any questions or concerns or would like to discuss anything further.
When this video ends, you can follow the instructions in your invitation letter to get a link to complete the online family history questionnaire. When you have completed this, please book an appointment with a genetic counsellor as per the instructions in your invitation letter. Genetic testing is carried out on a sample of your blood. If you decide to be tested, you will have a blood sample taken following your appointment. Your genetic counsellor will let you know when your test result will be available, which is typically around 8 weeks, but this can vary. They will be your point of contact for any follow-up queries. If you are feeling unsure about testing or would like to have a more detailed consultation, then follow the instructions in your invitation letter to arrange a 45-minute appointment with your genetic counsellor. Thank you for watching.